Question 1. Research into optimizing infection control processes within a medical transcription setting. Considering the unique challenges of a remote or hybrid work environment, what is the most effective strategy for a certified medical transcriptionist to proactively manage the risk of transmitting infectious agents while ensuring the integrity of patient health information? Option A. Implementing a rigorous personal hygiene regimen, regularly disinfecting all transcription equipment and workspace surfaces, and actively seeking out and incorporating the latest infection control guidelines from reputable health organizations into daily practice. Option B. Minimizing the importance of ongoing infection control training, believing that existing knowledge is adequate for current professional demands. Option C. Relying on the assumption that personal immunity is sufficient to prevent the transmission of common pathogens encountered in a healthcare setting. Option D. Delegating all infection control responsibilities to other healthcare staff, such as IT support for equipment sanitization and administrative staff for general office hygiene. The correct answer is A. Implementing a rigorous personal hygiene regimen, regularly disinfecting all transcription equipment and workspace surfaces, and actively seeking out and incorporating the latest infection control guidelines from reputable health organizations into daily practice. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent risk of healthcare-associated infections, high, and the critical role of a medical transcriptionist in maintaining patient safety and data integrity. The transcriptionist must balance the need for efficient workflow with the absolute necessity of preventing the spread of infectious agents, which could compromise patient care and violate privacy regulations. The challenge lies in implementing infection control measures that are both effective and practical within the transcription environment, ensuring compliance with established healthcare standards. Correct approach analysis. The correct approach involves a multifaceted strategy that prioritizes established infection control protocols and continuous professional development. This includes adhering to universal precautions, maintaining meticulous personal hygiene e.g., frequent hand washing, regularly disinfecting frequently touched surfaces and equipment, and promptly reporting any potential breaches in sterile technique or exposure incidents. Furthermore, staying updated on current guidelines from relevant health authorities, such as the Centers for Disease Control and Prevention, CDC in the U.S., is paramount. This proactive stance ensures that transcription practices align with the latest evidence-based recommendations for infection prevention, thereby safeguarding patient health and upholding professional ethical obligations. This approach directly addresses the regulatory framework for medical transcription, which implicitly or explicitly mandates adherence to healthcare safety standards to protect patient information and well-being. Incorrect approaches analysis. One incorrect approach is to rely solely on the assumption that personal immunity is sufficient to prevent transmission. While individual immunity plays a role, it does not negate the responsibility to prevent the spread of pathogens to vulnerable patients or colleagues. This approach fails to acknowledge the principles of universal precautions and the potential for asymptomatic shedding of infectious agents, leading to a direct violation of healthcare safety regulations and ethical duties. Another incorrect approach is to delegate infection control responsibilities entirely to other healthcare personnel, such as housekeeping or nursing staff. While these roles are crucial, the medical transcriptionist has a direct responsibility for their immediate work environment and personal practices. Overlooking personal hygiene and equipment disinfection, even if other staff are involved in broader cleaning efforts, creates a significant risk of transmission and contravenes the expectation of individual accountability within a healthcare setting, potentially violating HIPAA, Health Insurance Portability and Accountability Act, indirectly by compromising the integrity of patient data through an unsafe environment. A third incorrect approach is to disregard or minimize the importance of ongoing training in infection control. Medical knowledge and best practices evolve. Failing to stay current with updated guidelines from bodies like the CDC means that transcriptionists may be unknowingly employing outdated or ineffective infection prevention methods, increasing the risk of HAIs, and failing to meet the standards of care expected in the healthcare industry. This can be seen as a failure to maintain professional competence, which is a cornerstone of ethical practice and regulatory compliance. Professional reasoning. Professionals in medical transcription must adopt a proactive and informed approach to infection control. This involves understanding the principles of infection transmission, recognizing personal responsibility in preventing spread, and committing to continuous learning. When faced with situations involving potential infection risks, the decision-making process should involve 1. Identifying the potential risks based on current knowledge of infectious diseases and transmission routes. 2. Consulting relevant regulatory guidelines and professional best practices, e.g., CDC, OSHA. 3. Implementing preventative measures consistently and diligently. 4. Seeking clarification or additional training when uncertainties arise. 5. Reporting any breaches or concerns promptly to appropriate supervisors or infection control departments. This systematic approach ensures that patient safety and data integrity are always prioritized, aligning with both ethical obligations and regulatory requirements. Question 2. The monitoring system demonstrates a physician dictating a patient encounter, noting patient presence with a persistent cough, elevated temperature, and increasing difficulty breathing over the past 48 hours. Based on your knowledge of common diseases and conditions, what is the most appropriate action for the medical transcriptionist to take regarding the transcription of these findings? Option A. Transcribe the symptoms and add a note suggesting the patient likely has bronchitis. Option B. Transcribe the symptoms and immediately contact the physician to confirm a diagnosis of pneumonia. Option C. Transcribe the symptoms accurately and ensure they are clearly documented in the patient's record, recognizing their potential significance for a common respiratory illness. Option D. Transcribe the symptoms and omit any mention of breathing difficulty to simplify the report. The correct answer is C. Transcribe the symptoms accurately and ensure they are clearly documented in the patient's record, recognizing their potential significance for a common respiratory illness. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the medical transcriptionist to identify a potentially critical, yet subtly presented medical condition based on a limited set of symptoms. The challenge lies in accurately interpreting the provided information, recognizing the significance of the described symptoms in relation to common diseases, and understanding the implications of misinterpretation for patient care and regulatory compliance. The transcriptionist must exercise sound clinical judgment within the scope of their role, balancing accuracy with efficiency. Correct approach analysis. The correct approach involves recognizing that the described symptoms, particularly the combination of fever, cough, and shortness of breath, are highly suggestive of pneumonia. Pneumonia is a common and potentially serious respiratory infection that requires prompt diagnosis and treatment. Accurately transcribing these symptoms and flagging them as potentially indicative of pneumonia aligns with the medical transcriptionist's responsibility to produce accurate and complete medical records, which are crucial for subsequent clinical decision-making. This adheres to the general principles of medical record accuracy and completeness expected under healthcare regulations, ensuring that the treating physician has the necessary information to proceed with appropriate diagnostic and therapeutic interventions. Incorrect approaches analysis. One incorrect approach would be to transcribe the symptoms literally without considering their potential diagnostic implications. This fails to leverage the transcriptionist's knowledge of common diseases and conditions, potentially delaying or obscuring a critical diagnosis. This oversight could be considered a failure in professional diligence, as it neglects the implicit expectation that a trained medical transcriptionist will recognize and accurately represent significant clinical findings. Another incorrect approach would be to overstep the scope of practice by attempting to definitively diagnose the condition or recommend specific treatments. While recognizing potential diagnoses is part of the role, making a definitive diagnosis or offering treatment advice is the responsibility of the licensed medical professional. This would constitute a regulatory violation by practicing medicine without a license and could lead to patient harm. A third incorrect approach would be to ignore the symptoms altogether or transcribe them inaccurately due to haste or lack of attention. This directly compromises the integrity of the medical record, which is a legal document. Inaccurate or incomplete records can lead to misdiagnosis, inappropriate treatment, and potential legal ramifications for both the healthcare provider and the transcriptionist, violating regulations pertaining to medical record-keeping standards. Professional reasoning. Medical transcriptionists should employ a decision-making framework that prioritizes accuracy, adherence to scope of practice, and understanding of common medical conditions. This involves 1. Careful listening and accurate transcription of all dictated information. 2. recognizing patterns of symptoms that are commonly associated with specific diseases or conditions. 3. Understanding when to flag potentially critical findings for review by the dictating physician without making definitive diagnoses. 4. Maintaining awareness of regulatory requirements for medical record accuracy and completeness. 5. Continuously updating knowledge of common diseases and their typical presentations. Question 3. Compliance review shows a medical transcriptionist has encountered dictation regarding a complex surgical procedure involving multiple body systems, including the cardiovascular, respiratory, and nervous systems. The dictator's pronunciation of a specific anatomical structure within the nervous system is unclear, and a critical medication dosage for cardiovascular management is also difficult to discern. What is the most appropriate course of action to ensure accuracy and compliance with U.S. regulatory frameworks for medical transcription? Option A. Rely solely on the spell check and grammar functions of the transcription software to identify and correct any potential misspellings of the unclear terms. Option B. Flag the unclear dictation for clarification with the physician and consult authoritative medical resources to verify the correct spelling and context of the anatomical structure and medication dosage before finalizing the report. Option C. Make an educated guess based on the surrounding dictation to complete the report quickly, assuming the physician will review and correct any errors. Option D. Omit the unclear anatomical term and medication dosage from the report to avoid potential errors and expedite completion. The correct answer is B. Flag the unclear dictation for clarification with the physician and consult authoritative medical resources to verify the correct spelling and context of the anatomical structure and medication dosage before finalizing the report. Explanation. This scenario presents a professional challenge due to the critical nature of accurately transcribing medical information related to complex body systems. Errors in transcription, especially concerning the musculoskeletal, cardiovascular, respiratory, digestive, nervous, endocrine, urinary, and reproductive systems, can lead to misdiagnosis, inappropriate treatment, and patient harm. The medical transcriptionist must possess a thorough understanding of anatomical terminology, physiological processes, and common pathologies within each system to ensure fidelity and clarity in the dictated reports. The challenge lies in balancing speed with accuracy, maintaining confidentiality, and adhering to strict regulatory guidelines. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance above all else. By meticulously reviewing and verifying the transcribed information against established medical terminology and the specific context of the dictated report, the transcriptionist ensures the accuracy and integrity of the medical record. This aligns with the fundamental ethical obligation to provide competent and reliable services, as well as the regulatory requirement to maintain accurate and complete patient records, which is paramount under the Health Insurance Portability and Accountability Act, HIPAA, in the United States. Adherence to established style guides and the physician's preferences further enhances the clarity and usability of the report, directly impacting patient care. An incorrect approach that involves making assumptions about unclear dictation is professionally unacceptable. This directly violates the principle of accuracy and can lead to significant patient harm if the assumption is incorrect. It represents a failure to uphold the standard of care expected of a medical transcriptionist and a potential violation of HIPAA privacy rule by creating an inaccurate record that could lead to improper treatment. Another incorrect approach, such as omitting potentially ambiguous terms to expedite completion, is also professionally unacceptable. This compromises the completeness and accuracy of the medical record. Ambiguous terms, if left unaddressed, can lead to misinterpretation by healthcare providers, potentially resulting in diagnostic errors or inappropriate therapeutic interventions. This also falls short of the accuracy standards mandated by regulatory bodies and ethical codes. Finally, an incorrect approach that involves relying solely on spell-check software without manual verification is professionally unacceptable. While spell-check is a useful tool, it cannot discern medical context or differentiate between similarly spelled but medically distinct terms. This can lead to critical errors in transcribing diagnoses, medications, or anatomical structures, directly impacting patient safety and violating regulatory requirements for accurate record-keeping. The professional decision-making process for similar situations should involve a systematic approach. First, Listen carefully to the dictation, paying close attention to nuances in pronunciation and context. Second, if any part of the dictation is unclear or ambiguous, flag it for clarification with the dictator. Third, cross-reference unfamiliar terms or complex anatomical descriptions with reputable medical dictionaries and resources. Fourth, adhere strictly to established style guides and the specific instructions provided by the healthcare facility or physician. Finally, always prioritize accuracy and patient safety over speed, understanding that a correctly transcribed report is a vital component of effective healthcare delivery. Question 4. Which approach would be most appropriate for a certified medical transcriptionist to ensure accuracy when encountering an unfamiliar acronym in a dictated medical report, adhering strictly to U.S. regulatory frameworks and professional certification guidelines? Option A. Assume the acronym's meaning based on its common usage in general online searches. Option B. Rely on personal experience and prior knowledge of acronyms from previous work environments. Option C. Use a personal shorthand list of acronyms compiled over time without formal verification. Option D. Consult authoritative, up-to-date medical dictionaries, glossaries, and the specific healthcare facility's approved abbreviation list. Correct answer is D. Consult authoritative, up-to-date medical dictionaries, glossaries, and the specific healthcare facility's approved abbreviation list. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of medical documentation and the potential for misinterpretation of acronyms. Inaccurate transcription of acronyms can lead to significant patient safety risks, including incorrect diagnoses, inappropriate treatments, and medication errors. The Medical Transcriptionist Certification Exam emphasizes adherence to regulatory frameworks, particularly those governing patient privacy and data security, as well as the accuracy and integrity of medical records. Therefore, a meticulous and informed approach to acronym usage is paramount. Correct approach analysis. The correct approach involves a systematic and evidence-based method for verifying and understanding acronyms. This aligns with best professional practices for medical transcriptionists, which prioritize accuracy, patient safety, and compliance with regulatory standards. Specifically, referencing authoritative, up-to-date medical dictionaries, glossaries, and the specific facility's approved abbreviation list ensures that the transcriptionist is using the most current and contextually appropriate meaning of an acronym. This practice directly supports the integrity of the medical record, a core ethical and regulatory requirement. For example, under U.S. regulations, the Health Insurance Portability and Accountability Act, HIPAA, mandates the accuracy and security of protected health information, FI. Misinterpreting an acronym could lead to incorrect documentation, potentially compromising PHI or leading to adverse patient outcomes, which would be a regulatory failure. Incorrect approach is analysis. Relying solely on general internet searches for acronym meanings is professionally unacceptable because the internet contains a vast amount of unverified and potentially outdated information. This approach carries a high risk of misinterpretation, leading to transcription errors that could have severe consequences for patient care and violate regulatory requirements for accurate record keeping. For instance, a common acronym might have multiple meanings depending on the medical specialty or context, and a general search may not provide the correct one. Assuming an acronym's meaning based on prior experience without verification is also a significant professional and ethical failure. Medical terminology and abbreviations evolve, and what was once common practice may be outdated or superseded. This assumption-based approach bypasses the necessary due diligence required for accurate transcription and can lead to errors that compromise patient safety and violate the principle of fidelity in healthcare. Using a personal shorthand or a list of acronyms created for a previous, unrelated employer is a direct violation of professional standards and potentially regulatory requirements. Each healthcare facility or system may have its own specific approved abbreviation list, and using an external or outdated list can introduce errors and inconsistencies into the medical record. This practice demonstrates a lack of attention to detail and a failure to adhere to the specific guidelines of the current work environment, which is crucial for maintaining the integrity of patient data as mandated by regulations like HIPAA. Professional reasoning. Professionals in medical transcription must adopt a decision-making process that prioritizes accuracy, patient safety, and regulatory compliance. This involves a commitment to continuous learning and verification, When encountering an unfamiliar or potentially ambiguous acronym, the professional should 1. Consult the facility's approved abbreviation list first. 2. If not found, refer to authoritative, current medical dictionaries or glossaries. 3. If still uncertain, seek clarification from the dictating physician or a designated supervisor. This systematic approach minimizes the risk of error and ensures that all transcriptions are accurate, secure, and compliant with relevant regulations. Question 5. The review process indicates a medical transcriptionist has been observed discussing specific patient case details, including diagnoses and treatment plans, with a colleague in a non-work-related setting. The transcriptionist believes this discussion is acceptable because the colleague is also a healthcare professional, and the conversation is intended to share learning experiences. Which of the following actions best upholds legal and ethical standards for a medical transcriptionist? Option A. Discuss patient information with family members to illustrate the importance of medical accuracy in transcription, emphasizing the need for vigilance. Option B. Refrain from discussing any patient-specific information with colleagues outside of direct, work-related communication channels, regardless of their professional background or the perceived educational benefit. Option C. Share patient case details with healthcare professional colleagues in informal settings to foster professional development and knowledge sharing, provided the colleague is also bound by professional ethics. Option D. Use anonymized patient scenarios as examples in social conversations to highlight the complexities of medical terminology, ensuring no identifying details are revealed. Correct answer is B. Refrain from discussing any patient-specific information with colleagues outside of direct, work-related communication channels, regardless of their professional background or the perceived educational benefit. Explanation. The review process indicates a potential breach of patient privacy and confidentiality, which are paramount in medical transcription. The scenario presents a common ethical dilemma where a transcriptionist might be tempted to share information for reasons that, while seemingly benign, violate professional standards and legal mandates. The correct approach demonstrates best professional practice by prioritizing patient confidentiality and adhering strictly to HIPAA regulations. This involves recognizing that any unauthorized disclosure, regardless of intent or perceived benefit, constitutes a violation. Maintaining a secure work environment and understanding the scope of one's professional responsibilities are crucial. An incorrect approach that involves discussing patient information with a colleague outside of a direct work-related context, even if the colleague is also a healthcare professional, represents a failure to uphold patient privacy. This action violates the principle of least privilege and can lead to unauthorized access and disclosure of protected health information. 5. It also fails to recognize that professional relationships do not automatically grant permission to share patient data. Another incorrect approach, sharing patient details with family members to illustrate a point, is a severe ethical and legal breach. This demonstrates a fundamental misunderstanding of the doctor-patient relationship and the stringent requirements for safeguarding PHI. It exposes the patient to significant privacy risks and can result in legal penalties for both the transcriptionist and the healthcare facility. A third incorrect approach, using patient information as an example in a non-work-related social setting, is equally egregious. This action completely disregards the professional and legal obligations to protect patient confidentiality. It not only violates HIPAA, but also erodes trust within the healthcare system and can have devastating consequences for the patient. The professional reasoning process for such situations involves a clear understanding of the relevant legal frameworks, such as HIPAA in the United States, and the ethical codes of conduct for medical transcriptionists. When faced with a situation where patient information might be shared, the professional must ask, is this disclosure absolutely necessary for patient care or operational efficiency? Am I authorized to share this information? Is this disclosure compliant with all applicable laws and regulations? If the answer to any of these questions is no, the information must not be shared. Maintaining a strict adherence to policies and procedures, seeking clarification from supervisors when in doubt, and consistently prioritizing patient privacy are essential for ethical and legal compliance. Question 6. The analysis reveals that a medical transcriptionist is experiencing a plateau in their typing speed and accuracy. Considering the paramount importance of precise and timely documentation in healthcare, Which of the following approaches to improving touch typing techniques best aligns with professional best practices and regulatory expectations for accuracy and efficiency? Option A. Developing a personalized typing method that prioritizes rapid key strikes, even if it involves occasional glances at the keyboard or unconventional finger usage, to maximize immediate output. Option B. Implementing a structured practice regimen focusing on proper hand placement on the home row, consistent finger-to-key mapping without visual reliance, and maintaining correct posture to enhance both speed and accuracy sustainably. Option C. Focusing solely on increasing typing speed through sheer repetition, without dedicated attention to the underlying touch typing techniques or ergonomic considerations. Option D. Relying on autocorrect and spell check features to compensate for typing inaccuracies, allowing for a more relaxed approach to key accuracy during transcription. The correct answer is B. Implementing a structured practice regimen focusing on proper hand placement on the home row, consistent finger-to-key mapping without visual reliance, and maintaining correct posture to enhance both speed and accuracy sustainably. Explanation. The analysis reveals a common challenge in medical transcription: maintaining high accuracy and speed while adhering to evolving best practices in touch typing. This scenario is professionally challenging because transcriptionists are expected to produce error-free documents under time pressure, and their typing proficiency directly impacts both quality and efficiency. The need for continuous skill development in touch typing is paramount, as outdated techniques can lead to increased errors, slower turnaround times, and potential patient safety risks if critical information is mistranscribed. Careful judgment is required to balance speed with accuracy and to adopt techniques that promote long-term ergonomic health and sustained productivity. The correct approach represents best professional practice because it prioritizes foundational touch typing techniques that promote accuracy, speed, and ergonomic well-being. This involves maintaining proper posture, hand placement on the home row keys, and using all 10 fingers without looking at the keyboard. These techniques are universally recognized as the most effective for developing efficient and accurate typing skills, directly contributing to the transcriptionist's ability to meet professional standards for accuracy and turnaround time as mandated by industry best practices, and implied by the need for reliable medical documentation. Adherence to these techniques minimizes errors, reduces strain, and fosters a sustainable and productive career. An incorrect approach that involves hunt and peck typing, or relying heavily on visual cues from the keyboard, represents a significant regulatory and ethical failure. This method inherently leads to slower speeds and a higher propensity for errors, which can compromise the integrity of patient records. Inaccurate medical documentation can lead to misdiagnosis, incorrect treatment, and adverse patient outcomes, violating the fundamental ethical duty of care and potentially contravening regulations related to the accuracy and completeness of medical records, such as those enforced by HIPAA in the U.S., which mandates accurate and secure patient information. Another incorrect approach, such as developing a unique, non-standardized typing method that prioritizes speed over accuracy or ergonomics, also poses risks. While seemingly efficient in the short term, such methods often lead to repetitive strain injuries and can still result in errors due to a lack of systematic finger-to-key mapping. This can indirectly impact compliance by leading to a decline in the quality of work over time, potentially violating professional standards. The professional reasoning process for similar situations should involve a commitment to continuous learning and skill refinement. Transcriptionists should regularly assess their typing proficiency, identify areas for improvement, and actively seek training or practice methods that reinforce best practices in touch typing. This includes understanding the ergonomic principles behind effective typing to prevent injury and maintain long-term productivity. When faced with performance challenges, a professional should first evaluate their foundational skills, such as touch typing technique, before attributing issues solely to external factors. This self-assessment and proactive skill development are crucial for maintaining high-quality output and adhering to professional and ethical obligations within the medical transcription field. Question 7. Strategic planning requires a medical transcriptionist to accurately interpret the meaning of medical terms based on their constituent parts. If a physician dictates the patient presents with acute gastritis, and the transcriptionist correctly identifies gastritis as the key diagnosis, what is the primary impact of correctly understanding the suffix itis in this context? Option A. It suggests a benign growth within the stomach lining. Option B. It signifies inflammation of the stomach, leading to an accurate diagnosis of a medical condition. Option C. It denotes the study or science of the stomach. Option D. It indicates a surgical procedure to remove a part of the stomach. The correct answer is B. It signifies inflammation of the stomach, leading to an accurate diagnosis of a medical condition. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a medical transcriptionist to accurately interpret and transcribe medical terminology, specifically focusing on the impact of common suffixes on the meaning of a diagnosis. Misinterpreting a suffix can lead to a completely incorrect diagnosis being documented, which has severe implications for patient care, treatment decisions, and billing. The pressure to transcribe quickly and accurately, combined with the nuanced meanings of medical terms, necessitates a deep understanding of word roots, prefixes, and suffixes. Correct approach analysis. The correct approach demonstrates best professional practice by accurately identifying the suffix itis and understanding its meaning, which signifies inflammation. This allows for the correct transcription of the term gastritis as inflammation of the stomach. This accuracy is paramount for patient safety and adheres to the fundamental ethical and regulatory requirement of producing a verbatim and accurate medical record. The Medical Transcriptionist Certification exam emphasizes this foundational knowledge, as it directly impacts the integrity of the patient's health information, which is governed by regulations like HIPAA in the U.S., mandating accurate and secure record-keeping. Incorrect approaches analysis. One incorrect approach involves misinterpreting itis as a surgical removal. This is a critical failure because it fundamentally misunderstands the meaning of the suffix. For example, if the term were gastrectomy, the suffix ectomy would indicate surgical removal. Transcribing gastritis as a surgical removal would lead to a completely erroneous diagnosis and treatment plan, violating the core principle of accurate medical documentation and potentially leading to severe patient harm. This directly contravenes the spirit and letter of regulations requiring accurate medical records. Another incorrect approach involves assuming itis refers to a study of a body part. This is also a significant error. The suffix ology typically denotes the study of a subject, e.g. cardiology is the study of the heart. Transcribing gastritis as the study of the stomach would misrepresent the patient's condition, leading to incorrect medical interventions and potentially violating patient privacy and data integrity regulations by creating a false record. A third incorrect approach might involve simply omitting the suffix or transcribing it incorrectly without understanding its meaning. This also compromises the accuracy of the medical record. The suffix provides crucial information about the nature of the condition. Failing to accurately transcribe or interpret it means the medical record is incomplete and potentially misleading, which is a direct violation of the standards expected for certified medical transcriptionists and the regulatory frameworks governing healthcare documentation. Professional reasoning. Professionals should approach such situations by systematically breaking down medical terms into their component parts, root word, prefix, and suffix. When encountering an unfamiliar term or a common suffix, they should consult reliable medical dictionaries or terminology resources. In a testing scenario, the ability to recall and apply knowledge of common suffixes is a direct measure of competency. The decision-making process involves 1. Identifying the term, 2. Analyzing its components, particularly the suffix, 3. Recalling or looking up the meaning of the suffix, 4. Applying that meaning to the root word to understand the overall term, 5. Transcribing the term accurately based on this understanding. This methodical approach ensures accuracy and adherence to professional and regulatory standards. Question 8. Strategic planning requires a medical transcriptionist to transcribe a dictated operative report. The dictation includes a description of a surgical procedure that, when formatted strictly according to the facility's established style guide, e.g., using specific abbreviations or sentence structures, becomes ambiguous regarding the exact location of a critical anatomical structure. The style guide does not explicitly address this specific ambiguity. What is the most appropriate course of action? Option A. Transcribe the report verbatim, applying the style guide's formatting rules precisely, even if it results in ambiguity about the anatomical location. Option B. Transcribe the report, applying the style guide's formatting rules, but add a parenthetical note to the dictating physician, highlighting the potential ambiguity regarding the anatomical location and requesting clarification. Option C. Omit the portion of the dictation describing the anatomical location to avoid formatting conflicts and potential ambiguity. Option D. Transcribe the report, interpreting the dictation to make the anatomical location unambiguous according to the style guide's intent, without consulting the physician. The correct answer is A. Transcribe the report verbatim, applying the style guide's formatting rules precisely, even if it results in ambiguity about the anatomical location. Explanation. This scenario presents a professional challenge because it forces a medical transcriptionist to balance adherence to established formatting and style guidelines with the potential for misinterpretation or omission of critical clinical information due to those guidelines. The core conflict lies in prioritizing the integrity and clarity of the medical record over strict, potentially inflexible, stylistic rules. The correct approach represents best professional practice because it prioritizes patient safety and accurate communication of clinical data, which are paramount in healthcare. Adhering to the specified formatting and style guidelines is important, but not at the expense of the medical record's primary purpose, to convey accurate and complete patient information. When a guideline conflicts with clarity or accuracy, the transcriptionist has an ethical and professional responsibility to seek clarification or flag the discrepancy. This aligns with the fundamental ethical principles of beneficence, acting in the patient's best interest, and non-maleficence, avoiding harm, as a misformatted or incomplete report could lead to medical errors. An incorrect approach that strictly adheres to the formatting guideline, without considering the potential for misinterpretation or omission, fails to uphold the principle of accuracy and completeness in medical documentation. This could lead to patient harm if the omitted or unclear information is clinically significant. Another incorrect approach, which involves unilaterally altering the dictation to fit the formatting without noting the change, is a direct violation of professional integrity and accuracy. It constitutes falsification of the record, even if unintentional, and bypasses the established channels for resolving formatting conflicts. This erodes trust in the transcription process and the medical record itself. The professional decision-making process for similar situations should involve a clear understanding of the relevant formatting and style guidelines, a critical assessment of how those guidelines impact the clarity and accuracy of the transcribed content, and a proactive approach to resolving any conflicts. This includes identifying potential ambiguities or omissions caused by strict adherence to a rule, consulting with the dictating physician or a supervisor when necessary, and documenting any deviations or clarifications made. The ultimate goal is to produce a medical record that is both compliant with standards and, more importantly, clinically accurate and unambiguous. Question 9. During the evaluation of a dictated operative report, the physician dictates, the incision was made along the anterior aspect of the humerus, extending towards the medial condyle. The transcriptionist recognizes that anterior aspect is generally understood as the front of the humerus, but the phrase extending towards the medial condyle implies a direction that might be better described using a different directional term in relation to the humerus's overall orientation. The transcriptionist is unsure if the physician intended to describe a specific surgical approach or if there might be a slight imprecision in the dictation. Option A. Transcribe the phrase verbatim, assuming the physician's dictation is precise and the intended meaning is clear. Option B. Transcribe the phrase verbatim but add a parenthetical note stating, directional term may require clarification. Option C. Rephrase the dictated phrase to, the incision was made on the anterior surface of the humerus, extending towards the medial condyle, assuming this is a more standard anatomical description. Option D. Transcribe the phrase verbatim and then immediately contact the physician to clarify the intended directional terminology for the incision's path. The correct answer is D. Transcribe the phrase verbatim and then immediately contact the physician to clarify the intended directional terminology for the incision's path. Explanation. Scenario analysis. This scenario presents a professional challenge due to the potential for misinterpretation of anatomical terminology, which can have serious consequences for patient care and legal documentation. The transcriptionist must accurately translate spoken medical language into precise written records, adhering to established anatomical conventions. The ethical dilemma arises when the dictated term is ambiguous or potentially incorrect, forcing the transcriptionist to decide between verbatim transcription and seeking clarification. balancing speed with accuracy and patient safety. Correct approach analysis. The correct approach involves recognizing the ambiguity in the dictated term and proactively seeking clarification from the dictating physician. This upholds the highest professional standards by prioritizing accuracy and patient safety. Adhering to the principles of the medical transcriptionist certification exam's regulatory framework, which emphasizes accurate and complete medical records. This approach ensures that the final report reflects the physician's true intent. It aligns with ethical guidelines that mandate professional integrity and the avoidance of errors that could lead to misdiagnosis or improper treatment. Incorrect approach is analysis. Verbatim transcription of an ambiguous term without seeking clarification is professionally unacceptable. This approach fails to meet the accuracy requirements mandated by the medical transcriptionist certification framework. It risks perpetuating an error, potentially leading to incorrect medical documentation, which could have severe clinical and legal ramifications. Ethically, it demonstrates a lack of due diligence and a failure to uphold the responsibility of ensuring the integrity of the medical record. Assuming the meaning of an ambiguous term and transcribing it based on personal interpretation is also professionally unacceptable. This violates the core principle of accurate transcription, as it introduces the transcriptionist's subjective understanding rather than the physician's intended meaning. The medical transcriptionist certification framework strictly prohibits such assumptions, as they can lead to significant errors in patient charts. Ethically, it constitutes a breach of trust and professional responsibility, as the transcriptionist is not acting as a neutral conduit of information, but is instead altering the record based on conjecture. Transcribing the term as dictated but adding a parenthetical note questioning its accuracy is a partial improvement, but still falls short of best practice. While it acknowledges potential error, it does not resolve the ambiguity for the medical record. The medical transcriptionist certification guidelines emphasize resolving ambiguities definitively. Ethically, this approach creates a less-than-ideal record, potentially causing confusion for other healthcare providers who may not understand the nature of the uncertainty or how to proceed. Professional reasoning. Professionals facing such dilemmas should employ a decision-making process that prioritizes accuracy, patient safety, and adherence to regulatory guidelines. This involves 1. Identifying the ambiguity or potential error in the dictated text. 2. Consulting relevant resources, dictionaries, style guides, if the ambiguity is related to standard terminology. 3. If the ambiguity persists or involves a potentially incorrect anatomical term, the primary course of action is to seek immediate clarification from the dictating physician. 4. Documenting the clarification clearly in the record. This systematic approach ensures that the medical record is accurate, complete, and ethically sound, fulfilling the requirements of professional certification. Question 10. Risk assessment procedures indicate that a medical transcriptionist is reviewing a dictated report containing the phrase, "The patient presented with hypoglycemic symptoms." Which of the following interpretations of the prefix hypo is essential for accurate transcription in this context? Option A, indicating a condition of being within normal limits. Option B, indicating a condition of being below normal or deficient. Option C, indicating a condition of being above normal or excessive. Option D, indicating a condition of being intermittent or fluctuating. The correct answer is B, indicating a condition of being below normal or deficient. Explanation. This scenario is professionally challenging because the accurate transcription of medical terminology, particularly prefixes, is paramount for patient safety and effective communication within the healthcare system. Misinterpreting or incorrectly transcribing a prefix can fundamentally alter the meaning of a diagnosis, treatment, or procedure, leading to potentially severe consequences. The medical transcriptionist must possess a robust understanding of anatomical, physiological, and pathological terms, including the subtle but critical differences conveyed by prefixes. The correct approach represents best professional practice because it prioritizes accuracy and adherence to established medical terminology standards. By correctly identifying and transcribing the prefix hypo as indicating below normal or deficient, the transcriptionist ensures the medical record accurately reflects the physician's assessment of the patient's condition, such as hypoglycemia. This aligns with the core ethical and professional responsibility of a medical transcriptionist to produce a faithful and precise representation of the dictated report, which is a cornerstone of quality healthcare documentation and patient care. Adherence to these standards is implicitly required by the certification itself, which attests to a professional's competency in accurate medical transcription. An incorrect approach that transcribes hypo as hyper, meaning above normal or excessive, would be a critical error. This would represent a direct failure to meet the fundamental accuracy requirements of the profession. Ethically and professionally, this constitutes a breach of duty to the patient and the healthcare provider, as it introduces misinformation into the patient's record. Regulatory frameworks governing medical documentation, while not explicitly detailed in this exam scope, universally emphasize accuracy and the prevention of medical errors. Such a transcription error could lead to incorrect diagnoses, inappropriate treatment plans, and potentially harmful patient outcomes, directly violating the implicit trust placed in certified professionals. Another incorrect approach, such as omitting the prefix entirely or substituting it with a generic term, also fails to meet professional standards. While perhaps less immediately catastrophic than a complete reversal of meaning, it still results in an inaccurate and incomplete medical record. This demonstrates a lack of understanding or diligence in applying prefix knowledge, undermining the integrity of the transcription. It fails to convey the specific clinical nuance intended by the dictator, hindering clear communication and potentially leading to diagnostic ambiguity. The professional decision-making process for similar situations should involve a systematic approach. 1. Active listening and contextual understanding. Pay close attention to the dictated word and the surrounding clinical context. 2. Prefix knowledge application. Access and apply knowledge of common medical prefixes and their specific meanings. 3. Doubt resolution. If there is any uncertainty about a prefix or its meaning, consult reliable medical dictionaries, glossaries, or approved style guides. If still unresolved, flag the term for physician clarification. 4. Accuracy verification. Review the transcribed text for accuracy, ensuring that the intended meaning of the dictated report is preserved. Question 11. Quality control measures reveal that a dictated operative report lacks standard headings and subheadings, making it difficult to quickly locate specific procedural details. The dictation flows continuously without clear delineations. What is the most appropriate action for the medical transcriptionist to take to ensure the report is clear, accurate, and professionally presented? Option A. Arbitrarily insert headings and subheadings that seem appropriate without closely matching them to the dictated content. Option B. Infer logical headings and subheadings based on the content and established medical transcription guidelines to structure the report. Option C. Omit sections of the report that appear to lack clear structural cues, assuming they are less critical. Option D. Transcribe the report verbatim without adding any headings or subheadings, as they were not dictated. The correct answer is B. Infer logical headings and subheadings based on the content and established medical transcription guidelines to structure the report. Explanation. Scenario analysis. This scenario presents a common challenge in medical transcription, where the clarity and organization of a dictated report directly impact the accuracy and usability of the final transcribed document. The use of headings and subheadings is crucial for structuring complex medical information, making it easier for healthcare providers to quickly locate specific details. When these structural elements are missing or inconsistently applied, it can lead to misinterpretation, delays in patient care, and potential errors. The challenge lies in discerning the most appropriate way to impose structure when it's absent, balancing adherence to established transcription standards with the need to accurately reflect the dictated content. Correct approach analysis. The correct approach involves proactively identifying the absence of standard headings and subheadings, and then implementing them based on the content of the report and established medical transcription guidelines. This demonstrates a commitment to producing a clear, organized, and professional document that adheres to industry best practices. By inferring logical headings and subheadings, Transcriptionist enhances the readability and accessibility of the report, which is a core responsibility in ensuring accurate medical record keeping. This practice aligns with the implicit expectation of producing a high-quality, well-structured document, even when the dictation is less than ideal. Incorrect approach is analysis. One incorrect approach is to simply transcribe the report verbatim without adding any headings or subheadings, regardless of the content's complexity. This fails to meet the professional standard of producing a clear and organized medical document. It neglects the transcriptionist's role in enhancing the usability of the report, potentially leading to confusion for the end user and increasing the risk of errors. This approach prioritizes a literal interpretation of the dictation over the functional requirements of a medical record. Another incorrect approach is to arbitrarily insert headings and subheadings that do not accurately reflect the content of the dictated sections. This can lead to misrepresentation of the medical information, causing significant confusion and potentially leading to incorrect clinical decisions. It violates the fundamental principle of accurate transcription and can have serious patient safety implications. A third incorrect approach is to omit sections of the report that seem to lack clear structural cues, assuming they are less important. This is a critical failure as all dictated information is intended to be part of the medical record. Omitting content, even if poorly structured, is a direct violation of transcription accuracy and completeness. Professional reasoning. Professionals should employ a decision-making framework that prioritizes accuracy, clarity, and adherence to established guidelines. When faced with poorly structured dictation, the process involves 1. Thoroughly listening to and understanding the entire dictation. 2. Identifying logical breaks and thematic shifts in the content. 3. Consulting established medical transcription style guides and templates for common report types to infer appropriate headings and subheadings. 4. Applying these inferred structures consistently throughout the report. 5. Reviewing the transcribed document to ensure the added structure accurately reflects the dictated content and enhances readability without altering the original meaning. This systematic approach ensures that the transcribed document is not only accurate, but also professionally presented and maximally useful to healthcare providers. Question 12. Regulatory review indicates that accurate transcription of medical terminology is a cornerstone of patient safety and effective healthcare communication. A dictated term is cardiomyopathy. Which of the following analyses of its component parts best reflects the accurate understanding required for medical transcription certification? Option A. Cardio, heart, plus myo, muscle, plus pathy, disease, equals disease of the heart muscle. Option B. Cardi, heart, plus O, connecting vowel, plus myo, muscle, plus pathy, abnormal condition, equals abnormal condition of the heart muscle. Option C. Cardio, cardiac, plus myopathy, muscle disease, equals cardiac muscle disease. Option D. Cardio, cardiac, plus myo, myeloid, plus pathy, pathology, equals pathology of cardiac myeloid tissue. The correct answer is A. Cardio, heart, plus myo, muscle, plus pathy, disease, equals disease of the heart muscle. Explanation. The scenario presents a common challenge in medical transcription, accurately interpreting and transcribing medical terminology that relies heavily on prefixes, suffixes, and root words. Misinterpreting these components can lead to significant errors in patient records, impacting diagnosis, treatment, and billing. The professional challenge lies in the need for absolute accuracy and adherence to established medical terminology conventions, which are implicitly governed by the standards expected for certification. The correct approach represents best professional practice because it demonstrates a thorough understanding of etymology and its application to medical terms. By correctly identifying the root word and its modifying prefixes and suffixes, the transcriptionist ensures the accurate representation of the medical concept. This aligns with the core competency expected of a certified medical transcriptionist, which is to produce error-free documentation that precisely reflects the dictated information. This precision is paramount for patient safety and legal compliance, as dictated by the implicit standards of the medical transcriptionist certification exam, which requires adherence to accurate medical language. An incorrect approach that misinterprets a prefix, for example, by confusing hyper, excessive, with hypo, deficient, would fundamentally alter the meaning of a medical term, leading to a critical error. This failure directly violates the expectation of accuracy inherent in the certification process and could have severe clinical consequences. Similarly, misinterpreting a suffix, such as confusing itis, inflammation, with oma, tumor, would result in a completely different diagnosis being documented, posing a significant risk to patient care and potentially leading to legal ramifications for both the transcriptionist and the healthcare provider. Failure to recognize the correct root word, or incorrectly segmenting the word into its components, also leads to inaccurate transcription, undermining the integrity of the medical record. These errors are not merely stylistic. They represent a failure to meet the fundamental accuracy requirements for medical transcription and, by extension, for certification. Professional decision-making in such situations requires a systematic approach. First, listen carefully to the dictated term. Second, break down the term into its constituent parts, prefix, root, suffix. Third, analyze the meaning of each part. Fourth, synthesize the meanings to understand the complete medical term. And finally, verify the transcribed term against standard medical dictionaries or terminology resources if any doubt remains. This methodical process ensures accuracy and adherence to the high standards of the profession. Question 13. The audit findings indicate a discrepancy in a transcribed medical report that a supervisor has requested be adjusted to better reflect a different clinical impression, without providing any supporting documentation or revised dictation. As a medical transcriptionist, what is the most ethically sound and professionally responsible course of action? Option A. Immediately report the supervisor's request to the hospital's compliance officer without first attempting to discuss the matter with the supervisor. Option B. Politely refuse to alter the report without proper authorization and documentation, explaining the commitment to accuracy and patient confidentiality, and offer to retranscribe if new dictation is provided. Option C. Discreetly make the requested changes to the report without informing the supervisor, hoping the discrepancy goes unnoticed. Option D. Proceed with the requested adjustment to satisfy the supervisor and avoid potential conflict, assuming the supervisor has a valid reason. The correct answer is B. Politely refuse to alter the report without proper authorization and documentation, explaining the commitment to accuracy and patient confidentiality, and offer to retranscribe if new dictation is provided. Explanation. Scenario analysis. This scenario presents a significant ethical challenge for a medical transcriptionist. The core conflict lies between the professional obligation to maintain patient confidentiality and accuracy, and the pressure to comply with a request that could compromise these principles. The audit findings highlight a potential breach of protocol, necessitating a careful and ethical response that prioritizes patient well-being and regulatory compliance. The challenge is amplified by the fact that the request comes from a supervisor, potentially creating a power dynamic that could influence decision-making. Correct approach analysis. The correct approach involves a direct and professional communication with the supervisor, clearly stating the ethical and regulatory boundaries regarding patient information. This aligns with the core ethical principles of medical transcription, which include accuracy, confidentiality, and adherence to legal and regulatory standards such as HIPAA, Health Insurance Portability and Accountability Act. In the U.S., by refusing to alter the report without proper authorization and documentation, the transcriptionist upholds their professional integrity and protects the patient's privacy. This approach demonstrates a commitment to ethical practice and regulatory compliance, ensuring that patient records remain accurate and secure. Incorrect approaches analysis. Altering the report as requested without proper authorization or documentation is a direct violation of HIPAA privacy rule and security rule. It compromises the integrity of the medical record, potentially leading to misdiagnosis or inappropriate treatment, and constitutes a breach of patient confidentiality. This action also undermines the transcriptionist's professional responsibility to produce accurate and unaltered documentation. Failing to address the supervisor's request directly and instead ignoring it or attempting to subtly correct it without communication is also professionally unsound. It avoids the immediate conflict but does not resolve the underlying ethical issue, and leaves the supervisor unaware of the transcriptionist's adherence to ethical guidelines. This can lead to misunderstandings and future ethical dilemmas. Reporting the supervisor to a higher authority or external body without first attempting to resolve the issue through direct, professional communication is an escalation that bypasses a crucial step in professional problem solving. While reporting may be necessary in some circumstances, it should generally follow an attempt to address the issue directly and professionally with the individual involved, unless there is an immediate and severe risk of harm. Professional reasoning. Medical transcriptionists should employ a decision-making framework that prioritizes ethical conduct and regulatory compliance. This framework typically involves 1. Identifying the ethical issue and relevant regulations, e.g. HIPAA 2. Assessing the potential consequences of different actions. 3. Consulting professional codes of conduct and organizational policies. 4. Communicating directly and professionally with the involved parties to seek clarification or resolution. 5. Escalating the issue through appropriate channels if direct resolution is not possible or appropriate. In this scenario, the immediate step is to address the supervisor's request by clearly articulating the ethical and regulatory constraints. Question 14. The assessment process reveals a consistent pattern of minor transcription errors in a specific department's medical records, including occasional misspellings of common medical terms and slight inaccuracies in punctuation that do not alter the clinical meaning. The audit also notes that all records are signed off by a qualified physician within the required timeframe. What is the most appropriate next step for the audit team to ensure ongoing compliance and patient safety? Option A. Recommend a complete overhaul of the transcription software and hardware for the entire organization to address potential technological deficiencies. Option B. Immediately escalate the findings to the compliance officer for potential disciplinary action against the transcription staff. Option C. Conduct a superficial review of a larger sample size to confirm the presence of physician signatures, assuming the content accuracy is implicitly validated. Option D. Implement targeted training for the transcriptionists in that department, focusing on common error types, and review the department's workflow for potential contributing factors. The correct answer is D. Implement targeted training for the transcriptionists in that department, focusing on common error types, and review the department's workflow for potential contributing factors. Explanation. The assessment process reveals a critical juncture in maintaining the integrity and accuracy of medical transcription services, directly impacting patient care and regulatory compliance. This scenario is professionally challenging because it requires a nuanced understanding of both the technical aspects of transcription quality and the legal/ethical obligations governing protected health information. Under HIPAA, the auditor must balance the need for thoroughness with the practicalities of workflow and the potential for disruption. The correct approach represents best professional practice because it prioritizes a systematic, risk-based audit that focuses on identifying systemic issues rather than isolated errors. This aligns with the principles of continuous quality improvement mandated by healthcare regulations. By analyzing trends and patterns in transcription errors, the auditor can pinpoint specific training needs, process bottlenecks, or technology issues that, if addressed, will lead to a sustained improvement in accuracy and a reduction in the likelihood of future breaches or misinterpretations of patient data. This proactive approach minimizes the risk of significant patient harm and ensures ongoing compliance with HIPAA security rule and privacy rule, which emphasize the importance of safeguarding PHI and maintaining accurate records. An incorrect approach that focuses solely on the number of errors without considering their severity or root cause fails to provide actionable insights for improvement. This can lead to inefficient use of resources and may not address the underlying problems, leaving the organization vulnerable to repeated compliance failures. Another incorrect approach that involves immediate disciplinary action for any identified error, regardless of context or frequency, can create a climate of fear, discourage reporting of potential issues, and is not aligned with a constructive quality improvement framework. This can also lead to overlooking more significant systemic risks. A third incorrect approach that involves a superficial review, only checking for the presence of a signature without verifying the content's accuracy, completely undermines the purpose of an audit and leaves patient safety and data integrity compromised, directly violating the spirit and letter of HIPAA requirements for accurate and complete medical records. Professional reasoning in such situations should involve a structured risk assessment. This begins with understanding the audit's objectives and the regulatory landscape, HIPAA in this case. The auditor should then identify potential areas of risk, e.g., specific dictators, complex specialties, new transcriptionists. The audit methodology should be designed to assess these risks effectively, prioritizing critical elements like accuracy of diagnoses, procedures, and patient identifiers. Findings should be analyzed for trends and root causes, leading to targeted recommendations for improvement. Communication of findings should be clear, constructive, and focused on remediation, fostering a culture of accountability and continuous learning. Question 15. Implementation of standardized formatting for a discharge summary, ensuring all required sections such as patient demographics, admission and discharge diagnoses, hospital course, and discharge medications are clearly delineated according to the established U.S. regulatory framework for medical transcription certification, is crucial for maintaining the integrity and legal defensibility of the medical record. Which of the following actions best upholds this principle? Option A. Omitting the hospital course section if the admission and discharge diagnoses are clearly stated, as this information may be considered redundant. Option B. Condensing sections where possible to reduce the overall length of the report, assuming the essential information is still present. Option C. Utilizing a consistent, predefined template that includes all mandatory sections and adheres to industry-accepted formatting guidelines for medical reports. Option D. Employing unique formatting styles for each report to make them visually distinct and easier to identify. The correct answer is C. Utilizing a consistent, predefined template that includes all mandatory sections and adheres to industry-accepted formatting guidelines for medical reports. Explanation. This scenario presents a common challenge in medical transcription, ensuring adherence to established formatting standards for medical reports, which are critical for clarity, accuracy, and legal defensibility. The professional challenge lies in balancing the need for efficiency with the absolute requirement for compliance with the specific regulatory framework governing medical transcription certification in the United States. Failure to adhere to these standards can lead to misinterpretation of patient information, potential medical errors, and non-compliance with HIPAA and other relevant healthcare regulations. The correct approach represents best professional practice because it prioritizes the established standards for medical report formatting as mandated by the U.S. regulatory framework for medical transcription certification. These standards, often derived from industry best practices and regulatory guidelines such as those promoted by ADI, Association for Healthcare Documentation Integrity, and implicitly supported by HIPAA emphasis on accurate and complete health records, ensure consistency and legibility. Adhering to these guidelines, which typically include specific requirements for headings, patient identifiers, report types, and dictation structure, is essential for maintaining the integrity of the medical record and facilitating effective communication among healthcare providers. An incorrect approach that deviates from established formatting standards, even if seemingly more efficient, represents a significant regulatory and ethical failure. For instance, omitting standard report headings or using non-standard abbreviations without proper definition directly violates the principles of clear and accurate medical record keeping. This can lead to confusion, misdiagnosis, or delayed treatment, thereby compromising patient safety and potentially violating HIPAA mandates for the privacy and security of protected health information. 5. Through inaccurate or incomplete documentation. Furthermore, such deviations can undermine the credibility of the transcriptionist and the healthcare facility. The professional decision-making process for similar situations should involve a thorough understanding of the applicable U.S. regulatory framework and industry standards for medical transcription. When faced with a dictation that might lend itself to a non-standard format, the transcriptionist must first consult their facility's policies and procedures, which should be aligned with these overarching standards. If ambiguity exists, seeking clarification from a supervisor or referencing authoritative style guides is paramount. The guiding principle should always be the accurate and unambiguous representation of the medical information, prioritizing patient safety and regulatory compliance over perceived efficiency gains from non-standard practices. Question 16. The performance metrics show a slight increase in the average turnaround time for reports containing the abbreviation HTN. While the transcriptionist consistently transcribes HTN as hypertension, a review of recent dictations reveals instances where physicians have used HTN in contexts that might imply a specific type or severity of hypertension, rather than just the general condition. This raises a concern about the consistent and accurate interpretation of this common abbreviation. Option A. Omit the abbreviation HTN from the report when there is any doubt about its precise meaning to avoid potential misinterpretation. Option B. Continue transcribing HTN as hypertension as it is a widely recognized abbreviation, and the slight increase in turnaround time is acceptable for maintaining efficiency. Option C. Consult authoritative medical abbreviation lists, and if ambiguity persists or the abbreviation is non-standard, seek direct clarification from the dictating physician. Option D. Substitute HTN with a more descriptive phrase like elevated blood pressure if the context suggests a need for greater clarity, even if the physician dictated the abbreviation. The correct answer is C. Consult authoritative medical abbreviation lists, and if ambiguity persists or the abbreviation is non-standard, seek direct clarification from the dictating physician. Explanation. Scenario analysis. This scenario presents a common challenge in medical transcription, ensuring accuracy and adherence to established standards when encountering potentially ambiguous or non-standard abbreviations. The professional challenge lies in balancing the need for efficient transcription with the absolute requirement for patient safety and accurate medical record keeping. Misinterpreting or incorrectly transcribing abbreviations can lead to significant clinical errors, impacting diagnosis, treatment, and medication administration. Careful judgment is required to identify deviations from standard practice and to implement corrective actions that uphold the integrity of the medical record. Correct approach analysis. The correct approach, which involves consulting authoritative medical abbreviation lists and seeking clarification from the dictating physician when ambiguity exists, represents best professional practice. This aligns with the core principles of medical transcription, which prioritize accuracy, clarity, and patient safety. Regulatory frameworks for medical transcription, such as those governed by the Association for Healthcare Documentation Integrity (ADI), and implicitly by HIPAA emphasis on accurate record keeping, mandate that transcriptionists adhere to established standards. Consulting recognized resources like Stedman's Medical Dictionary or the ADI-owned guidelines ensures that commonly accepted abbreviations are used correctly. The proactive step of seeking physician clarification directly addresses any potential ambiguity, thereby preventing errors and ensuring the medical record accurately reflects the physician's intent. This approach is ethically sound as it prioritizes patient well-being and professionally responsible as it upholds the quality of the medical documentation. Incorrect approaches analysis. One incorrect approach involves transcribing the abbreviation as it is heard, assuming it is a recognized standard, without verification. This is a significant regulatory and ethical failure. It violates the implicit requirement for accuracy in medical records, which is fundamental to patient care and is a cornerstone of regulatory compliance under frameworks like HIPAA. Ethically, it demonstrates a lack of diligence and a disregard for potential patient harm. Another incorrect approach is to omit the abbreviation entirely from the report. This is also a regulatory and ethical failure. Omitting information from a medical record can lead to incomplete patient histories, hindering subsequent medical decision-making. It represents a failure to accurately transcribe the dictated information and can be considered a breach of professional duty. A third incorrect approach is to substitute a commonly used abbreviation that is similar but not identical to the one dictated, without verification. This is a critical regulatory and ethical failure. While seemingly efficient, it introduces a high risk of misinterpretation. The substituted abbreviation might have a different meaning or implication, leading to diagnostic or therapeutic errors. This directly compromises patient safety and violates the principle of accurate representation of the dictated content. Professional reasoning. Professionals should employ a decision-making framework that prioritizes accuracy and patient safety above all else. When encountering an abbreviation, the first step is to determine if it is a standard, recognized abbreviation. If it is, it should be transcribed correctly. If the abbreviation is unfamiliar, non-standard, or potentially ambiguous, the professional must consult authoritative medical abbreviation resources. If, after consulting resources, the abbreviation remains unclear or is clearly non-standard, the professional's next step must be to seek clarification directly from the dictating physician. This iterative process of verification, consultation, and clarification ensures the highest level of accuracy and minimizes the risk of errors in the medical record. Question 17. Cost-benefit analysis shows that investing in continuous professional development focused on anatomical root words significantly reduces transcription errors in reports concerning the musculoskeletal system. A newly certified medical transcriptionist encounters a dictated term that sounds like osteoarthritis, but is unsure if the root word refers to bone or joint. Which of the following approaches best reflects the required professional standard for accurate transcription of body system root words? Option A. Guess the intended meaning based on the overall flow of the dictation, prioritizing speed to meet turnaround times. Option B. Rely on a colleague's quick verbal confirmation without independently verifying the root word's meaning. Option C. Transcribe the term phonetically as heard, assuming the context will clarify the meaning. Option D. Utilize an online medical dictionary to confirm the root word osteo and its relation to bone, then transcribe osteoarthritis accurately. The correct answer is C. Transcribe the term phonetically as heard, assuming the context will clarify the meaning. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of accurate medical transcription, especially when dealing with complex anatomical and physiological terminology. Misinterpreting or incorrectly transcribing root words related to body systems can lead to significant diagnostic and treatment errors, directly impacting patient care and potentially leading to adverse outcomes. The challenge lies in ensuring absolute accuracy and adherence to established medical terminology standards within the regulatory framework governing medical transcription certification. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing the accurate identification and transcription of root words related to body systems. This aligns directly with the core competencies and ethical obligations of a certified medical transcriptionist. Regulatory frameworks for medical transcription certification, such as those established by the Association for Healthcare Documentation Integrity, ADI, in the U.S., emphasize the importance of a strong understanding of medical terminology, including root words, prefixes, and suffixes, to ensure the fidelity of transcribed documents. This accuracy is paramount for clear communication among healthcare providers and for maintaining comprehensive patient records, which are legally mandated and essential for continuity of care. Incorrect approaches analysis. An approach that focuses solely on the phonetic spelling of terms without understanding the underlying root words fails to meet the fundamental requirements of medical transcription. This is a regulatory failure because it bypasses the essential knowledge base expected of a certified professional, leading to potential misinterpretations of meaning and context. Ethically, it compromises the integrity of the medical record. An approach that relies on external translation tools for unfamiliar terms without verifying the accuracy against established medical dictionaries or glossaries represents a significant professional and regulatory lapse. While tools can be helpful, they are not a substitute for professional knowledge and critical judgment. This can lead to the introduction of errors or the perpetuation of inaccuracies, violating the standard of care and the certification requirements that mandate a high level of terminological expertise. An approach that prioritizes speed over accuracy, even when encountering terms related to body systems, is a direct violation of ethical and regulatory standards. The primary responsibility of a medical transcriptionist is to produce accurate and complete documentation. Rushing through the transcription process, especially with complex medical language, increases the likelihood of errors, which can have severe consequences for patient safety and healthcare delivery. This demonstrates a disregard for the professional responsibilities inherent in medical transcription certification. Professional reasoning. Professionals should employ a systematic approach that begins with a thorough understanding of the dictated content. When encountering terms related to body systems, they should actively recall or consult reliable medical dictionaries and terminology resources to confirm the correct spelling, meaning, and context of the root words. This involves cross-referencing information and applying their knowledge base to ensure the highest level of accuracy. If ambiguity persists, seeking clarification from the dictating physician, following established protocols, is a crucial step in professional decision-making. This process ensures adherence to regulatory requirements and upholds the ethical commitment to patient care and accurate medical record-keeping. Question 18. System analysis indicates a medical transcriptionist is processing a dictated operative report. During the description of a surgical procedure, the physician dictates a phrase that is heavily accented and unclear, making its exact meaning and spelling ambiguous. The transcriptionist has reviewed the audio multiple times and cannot confidently determine the intended medical term. What is the most appropriate transcription technique to employ in this situation? Option A. Transcribe the phrase phonetically and leave a blank space with a note indicating that the term was unintelligible. Option B. Attempt to infer the intended medical term based on the surrounding dictation and transcribe the most likely term. Option C. Transcribe the phrase as best as possible, using phonetic spelling and adding a note to the physician indicating the ambiguity and requesting clarification. Option D. Omit the unclear phrase from the transcript to avoid introducing a potential error. The correct answer is C. Transcribe the phrase as best as possible, using phonetic spelling and adding a note to the physician indicating the ambiguity and requesting clarification. Explanation. This scenario presents a professional challenge due to the inherent conflict between the need for accuracy in medical transcription and the potential for misinterpretation or omission of critical information when dealing with a non-standard dictation. The medical transcriptionist must balance the verbatim requirement with the ethical obligation to produce a clear and accurate record that facilitates patient care. Careful judgment is required to ensure that the final transcript reflects the physician's intent without introducing ambiguity or errors. The correct approach represents best professional practice because it prioritizes patient safety and accurate medical record-keeping, which are fundamental tenets of medical transcription ethics and regulatory compliance. By seeking clarification from the physician, the transcriptionist upholds the principle of accuracy and avoids the potential for downstream medical errors that could arise from an ambiguous or incomplete report. This aligns with the core responsibility of a medical transcriptionist to produce a faithful and understandable representation of the dictated information, ensuring that healthcare providers have reliable data for decision-making. An incorrect approach that involves guessing the intended meaning of the unclear phrase is professionally unacceptable. This constitutes a failure to adhere to the principle of accuracy and introduces a significant risk of medical error. The transcriptionist is not authorized to interpret or infer medical information. Their role is to transcribe what is dictated. Introducing assumptions, even with good intentions, violates professional standards and could lead to misdiagnosis or inappropriate treatment. This also fails to meet the regulatory requirement for accurate medical documentation. Another incorrect approach, that of omitting the unclear phrase entirely, is also professionally unacceptable. This results in an incomplete medical record, which can hinder continuity of care and potentially lead to critical information being missed by other healthcare providers. It represents a failure to capture the full dictation and can be seen as a dereliction of duty to produce a comprehensive report. This omission also violates the expectation of a verbatim transcription, even if the dictation is imperfect. The professional decision-making process for similar situations should involve a systematic approach. First, attempt to discern the meaning from context within the dictation itself. If clarity is still lacking, the immediate and primary recourse is to consult the dictating physician for clarification. This ensures that any ambiguities are resolved at the source, maintaining the integrity and accuracy of the medical record. If clarification is not immediately possible, the transcriptionist should flag the unclear portion and note the need for clarification, rather than proceeding with an assumption or omission. Question 19. Investigation of the process optimization strategies for medical transcriptionists, specifically concerning the integration of automated editing and proofreading tools into their workflow, leads to the question: when utilizing advanced software designed to identify potential errors in transcribed medical reports, what is the most appropriate and compliant professional practice to ensure the integrity and accuracy of the final document? Option A. Implement automated suggestions directly into the report without further human review, as the software is designed for accuracy. Option B. Conduct a thorough human review of the transcribed document, using the automated tool's flagged items as a guide for focused attention, but retaining final editorial control. Option C. Disregard all flagged errors from the automated tool, assuming they are a result of the software's limitations and not indicative of actual transcription mistakes. Option D. Accept all automated corrections and suggestions immediately, as this significantly speeds up the transcription process and is the primary purpose of such tools. The correct answer is A. Implement automated suggestions directly into the report without further human review, as the software is designed for accuracy. Explanation. Scenario analysis. This scenario presents a common challenge in medical transcription, balancing the efficiency offered by automated editing and proofreading tools with the absolute necessity of maintaining accuracy and patient safety. The professional challenge lies in recognizing the limitations of these tools and understanding that they are aids, not replacements, for human expertise. Over-reliance can lead to the perpetuation of errors, potentially impacting patient care and violating regulatory mandates for accurate medical records. The inherent complexity of medical terminology, context, and physician dictation styles necessitates a discerning human review. Correct approach analysis. The correct approach involves utilizing editing and proofreading tools as a preliminary step to identify potential errors, but always followed by a thorough, human-driven review. This aligns with the core principles of medical transcription certification, which emphasizes accuracy, integrity, and compliance with healthcare regulations. These tools can flag grammatical errors, misspellings, and inconsistencies, thereby optimizing the transcriptionist's time by directing their attention to areas that may require correction. However, the final verification of medical accuracy, appropriate terminology, and contextual understanding must be performed by a certified professional. This ensures that the transcribed document is a faithful and reliable representation of the dictated information, meeting the standards set by regulatory bodies like HIPAA in the U.S., which mandates accurate patient records and correct approaches analysis. Accepting all flagged corrections from an automated tool without independent verification is a significant regulatory and ethical failure. Such an approach bypasses the essential human oversight required for medical accuracy. It risks introducing new errors or failing to correct subtle but critical mistakes that automated tools might miss, such as incorrect drug names, dosages, or patient identifiers. This directly violates the principle of maintaining accurate and complete medical records, which is a cornerstone of patient safety and regulatory compliance under frameworks like HIPAA. Relying solely on the automated tool's output and skipping the human proofreading stage is another critical failure. This demonstrates a lack of professional responsibility and a misunderstanding of the tool's purpose. It treats the tool as infallible, which is demonstrably untrue for complex medical dictation. This can lead to the submission of inaccurate reports, potentially causing misdiagnosis, incorrect treatment, or other adverse patient outcomes, thereby violating ethical obligations to patients and professional standards. Ignoring flagged errors from the tool and proceeding with the transcription as dictated, without any review, is also professionally unacceptable. While this might seem to prioritize speed, it completely negates the value of the editing tools and, more importantly, the transcriptionist's role in ensuring accuracy. This approach disregards the potential for dictation errors, background noise, or unclear speech, all of which can be caught and corrected by a diligent human reviewer. It represents a dereliction of duty and a failure to uphold the accuracy standards expected of a certified medical transcriptionist. Professional reasoning. Professionals should approach editing and proofreading tools with a critical mindset, understanding them as assistive technologies. The decision-making process should involve 1. Initial automated review to identify obvious errors. 2. A comprehensive human review focusing on medical accuracy, context, and completeness, cross-referencing flagged items and independently verifying any ambiguous or potentially incorrect suggestions. 3. A final read-through to ensure overall clarity and adherence to established medical transcription guidelines and regulatory requirements. This layered approach ensures both efficiency and the paramount importance of accuracy in medical documentation. Question 20. What factors determine the appropriate level of detail and accuracy required when transcribing medical reports pertaining to the musculoskeletal, cardiovascular, respiratory, digestive, nervous, endocrine, urinary, and reproductive body systems, ensuring compliance with U.S. regulatory frameworks and professional ethical standards? Option A. Transcriptionists' personal familiarity with the patient's medical history and their subjective interpretation of the physician's dictation. Option B. The length of the dictation and the transcriptionist's desire to complete the task quickly to meet personal productivity goals. Option C. The specific medical specialty of the dictating physician, the complexity of the patient's condition within each body system, and the need for precise anatomical and physiological terminology. Option D. The perceived urgency of the report based on the transcriptionist's personal assessment and the availability of generic medical abbreviations. The correct answer is C. The specific medical specialty of the dictating physician, the complexity of the patient's condition within each body system, and the need for precise anatomical and physiological terminology. Explanation. This scenario is professionally challenging because it requires the medical transcriptionist to accurately and efficiently document complex medical information across multiple body systems, while adhering to strict regulatory requirements for accuracy, confidentiality, and timely delivery. The transcriptionist must possess a deep understanding of medical terminology, anatomy, physiology, and disease processes related to the musculoskeletal, cardiovascular, respiratory, digestive, nervous, endocrine, urinary, and reproductive systems. The pressure to maintain high accuracy while transcribing dictations from various specialists, each with their own dictation style and focus, demands meticulous attention to detail and a robust knowledge base. The correct approach represents best professional practice because it prioritizes patient safety and regulatory compliance above all else. By thoroughly reviewing and verifying the transcribed report against the original dictation and relevant medical knowledge, the transcriptionist ensures the accuracy of the documented information. This meticulous verification process directly aligns with the core principles of medical transcription, which include producing a verbatim, accurate, and complete record of the dictated information. Adherence to HIPAA, Health Insurance Portability and Accountability Act, regulations is paramount, ensuring patient privacy and data security. Furthermore, understanding the nuances of each body system allows for the correct interpretation and transcription of specialized medical terms, abbreviations, and procedures, preventing potential misinterpretations that could lead to diagnostic or treatment errors. This comprehensive approach upholds the professional integrity of the transcriptionist and contributes to the continuity and quality of patient care. An incorrect approach that focuses solely on speed without thorough verification would be a significant regulatory and ethical failure. This would violate the fundamental requirement for accuracy in medical documentation, potentially leading to patient harm if errors are incorporated into the medical record. Such an approach would also contravene HIPAA mandate for accurate and complete health information. Another incorrect approach, such as relying on external, unverified online resources for medical definitions or abbreviations, poses a risk of introducing misinformation and violates professional standards of practice. Medical transcriptionists are expected to utilize reliable, authoritative medical dictionaries and reference materials. Failing to maintain patient confidentiality by discussing case details or transcribing in an unsecured environment would be a direct violation of HIPAA and a severe ethical breach, jeopardizing patient trust and legal standing. The professional decision-making process for similar situations should involve a systematic approach. First, listen to the dictation carefully, paying close attention to the body system being discussed and any specialized terminology. Second, transcribe the dictation accurately, using appropriate medical terminology and formatting. Third, conduct a thorough review of the transcribed report, cross-referencing with the original dictation and consulting reliable medical resources as needed to ensure accuracy and completeness. Fourth, be vigilant about patient confidentiality and data security at all times. Finally, if any ambiguity or uncertainty arises, seek clarification from the dictating physician or a supervisor before finalizing the report. This structured process ensures that all regulatory requirements and ethical obligations are met, leading to high-quality, reliable medical documentation.